Hello, good morning. Thank you for coming. Before we get started, I'd like to begin with an acknowledgement and thank you to the Coast Salish nations of Musqueam, Tsleil-Waututh, and Squamish, on whose unceded traditional territories we stand. I'd also like to take to heart the need for not only acknowledgement, but for dialogue, learning, and reconciliation. My name is Jackie Kenyuk. I'm the Asset Management Coordinator for BC Nonprofit Housing Association. And I'm very pleased to moderate today's topic, preparing for extreme heat and poor air quality events, health impacts. Over the next 30 years, we can expect the number of extremely hot days each year to more than double in some parts of Canada. Heat illness is a serious health threat, and the risks for illness are greater for vulnerable populations. Older adults, people with chronic and mental illness, workers out in the heat, low-income earners, children, and people experiencing homeless are among the highest at risk. We are joined today by 4 speakers who carry extensive knowledge and experience on extreme heat and poor air quality. And I'll introduce each one of them and provide an outline before we get started. Our first speaker is Tamsin Mills, Senior Sustainability Specialist at the City of Vancouver. She developed and authored the city's first climate change adaptation plan in 2012 and managed its implementation. Tamsin led development of the recent refresh of the adaptation plan and was unanimously adopted by City Council in 2018. Followed by this is Dr. Sarah Henderson. Dr. Henderson is Senior Environmental Health Science at the BC Centre for Disease Control. She leads a program of applied research and surveillance to support evidence-based policy for the province. Her work spans a wide range of topics, including air pollution from all provincially relevant sources such as wildfire smoke, residential wood smoke, industry, road dust, shipping and vehicles, as well as extreme weather events, radon gas, food safety, water quality, and exposures managed by the Drug and Poison Information Center. Our third speaker is Dr. Michael Schwant. He's a public health physician with the BC Centre for Disease Control and clinical assistant professor at the UBC School of Population and Public Health. Dr. Schwant is a specialist in public health and preventative medicine and also trained as a family physician. He's committed to addressing social determinants of health and is a former board member of Upstream Institute for a Healthy Society. Dr. Schwant's major research and practice areas include environmental public health, global health, and health equity. And finally, Magdalena Sapala is a senior sustainability advisor at BC Housing. In the last few years, she led the development of BC Housing's first climate adaptation framework. Magda works on its implementation, focusing on extreme heat risks, and as a coordinator of the Mobilizing Building Adaptation and Resilience project that focuses on resilient building design and renovations. Magda holds a degree in psychology and master's degree in strategic leadership towards sustainability. Our session today is 90 minutes, which we have broken down into the following outline. This welcome and will be followed by Tamsin providing some of the air quality and heat projections to come. Dr. Henderson will lead us into some big picture statistics on health impacts, followed by symptoms, prevention, and response from Dr. Schwant. Tamsin's then going to let us know how the City of Vancouver is responding, and Magda will provide resources on tenant education for nonprofit housing staff. We will be welcoming questions for the remaining time, both from the floor here in Vancouver and for those of you joining us online. So we are joined by all of you in person and online who also have a depth of experience working with vulnerable populations, and we're delighted you could attend. And this session is being filmed and will be available and sent to all participants. Those of you listening online, please at any time you may type your questions into the Q&A box so we can weave those into the discussion at the end of the presentations. Without further ado, I'd like to bring along Tamsin Mills. Thanks.
Good morning, everyone, and thanks for having me. I'm going to set the context a bit with some climate change projections, so what we can expect in Vancouver and around BC. So last summer, pretty nice, warm, dry summer. Here's just one day at the end of the summer, August 29th, and the records that were broken across the province from Whistler to Kamloops to Vancouver. And of course, in the last 4 summers, we're all used to the skies looking a bit like this. In 2015, we had 8 days of air quality alerts, 2017, 19 days. And last year, I don't have the number of days yet, but I know we certainly had many complaints about health from those more sensitive to the air quality. So these are the infographics that the Pacific Climate Impacts Consortium at the University of Victoria helped us with for 2050. So this is Vancouver in a snapshot in 2050. So climate change is going to bring trends, shocks and stresses. So here's some trends: warmer, wetter winters and hotter, drier summers. So starting on the left at the top, almost a 60% decrease in snowpack, and that's in our water supply watersheds. So you can imagine that that's going to impact water supply. Winter temperatures are going up by almost 5 degrees. That nighttime temperature is going to be a lot warmer, which means a reduction in our home heating needs by almost 30%. Great for our energy bills in the winter. We'll talk about the summer in a sec. And of course, an increase in risk of coastal flooding. In the wintertime, when we get those big storms, high tides, and with sea level rise and storm surge, we can get some flooding around the coast. So in summertime, more frequent heat waves. The hottest days become even hotter, so we're looking at 37 instead of 32. Twice as many days over 25, and less rain. It's the only season of the year that we're going to see less rain. Some more trends: when it rains, it pours, and a longer growing season. So 15% longer growing season, 72% less frost. Snow is going to melt earlier, and we are seeing more rain and more rain in the spring, 20% more rain in April. And in terms of rain, when it rains, it's really going to pour. So those heavy rains become even more intense, and the volume of rain on those wettest days increases by about 20%. So of course, this leads to more urban flood risk and river flood risk. So just to go over those that are of interest today: climate projections to 2050 for the summertime, doubling of days above 25 degrees. Warmest days are 4 degrees warmer, and those very hot days are even hotter, so 37 instead of 32. Cooling degree days, which is a measure of the cooling load or our need for cooling in homes, is going to go from 60 to 250 degree days. So that's quite an increase. And days above 30 will occur 12 times more frequently. And while we don't have specific numbers for wildfire, we do have high confidence that there will be increasing wildfires with that smoke impact. Across the province, Vancouver Island, we have very similar projections to Vancouver projections. In the interior and the Caribou, also a lot of hotter and drier, longer dry seasons, so more consecutive dry days. The north is the anomaly. We're going to have more rain in the summer, but those may come in more specific large events. And temperatures are up as well in the north. So just briefly, some of the climate change impacts we can anticipate are increased risks for heat-related illness, increased risk for conflict due to heat, increased energy costs for cooling. So while we may be losing or having smaller energy bills in the winter, they'll be going up in the summer. Increased need for shelter during inclement weather, increased need for air filtration. And this morning on the news, they were talking about increased mental health from the anxiety and stress associated with some of these major events. So hopefully that sets the stage. And now I'll welcome Sarah, Dr. Henderson, up.
Thank you, Tamsin, and thank you, everybody, for inviting me to be here today. Oh, that is the wrong direction. There we go. So just an overview, I want to give kind of a really practical introduction to extreme hot weather and extreme air pollution using examples from previous summers, particularly in the Lower Mainland. And then I will talk a little bit about when these two different types of exposures meet. So we had an extreme hot weather event in the Lower Mainland in 2009. You can clearly see here the number of daily deaths are the blue bars. The maximum temperature is that red line, and as the red line increases, the number of daily deaths increases, and increases to, in some cases, more than 50% of the usual daily deaths that we expect on a summer day. Overall, we estimate that there were 110 excess deaths associated with hot weather in this 1 week period. That's a 40% increase in mortality for the region. And I always try to liken this to the H1N1 epidemic that happened later in the year. There were about 62 deaths province-wide from that epidemic, so about half of the deaths that we saw during this 1-week period. Which of these events did you hear more about in the news if you were around? This went almost entirely unnoticed, and except by people at the BC CDC and other places. And that's why we often call heat the silent killer. People are dying of it, and nobody really knows unless things get really, really bad. So we did some quick and dirty analyses around this event to try to establish who was at higher risk of mortality, and this was our first crack at the analysis. What we found is that people in the 65 to 74 age range were at higher risk than the very elderly. And that's a little bit different than what's been reported in other places. In Europe in 2003, it was the very elderly that were most at risk. We didn't see that here. We saw it sort of younger seniors being at higher risk. We also found that people died out of care. So instead of dying in a hospital or a care facility, they were actually dying at home or out in the community. That is a hallmark of these types of hot weather events. We found there was higher risk for those people living in more densely populated areas and higher risk for people living in lower income areas. But like I said, this was just an initial and rapid assessment of the situation. After this, we moved on to do some fancy statistics. When somebody dies because it's hot out, it actually rarely shows up in their death record as a death that was attributable to hot weather. So it's hard to tease apart the people who died because it was their time versus the people who died because it was very hot. We did some fancy statistics, and out of those 110 deaths, we found 73 that we felt quite sure were heat-related rather than deaths that were going to happen anyway. And I just want to show you some of the shifts in these 73 people compared with people who usually die on summer days. So first of all, 78% of them in the less than 75 age category compared with 37.4% under normal conditions. 38.4% died at home compared with 14.5% under normal conditions. Again, that's one of those key hallmarks of hot weather events. When we look at the deprivation index, which is a joint index of education and income and social connections at the census dissemination area scale, that deprivation index is usually broken into quantiles, so 20% of people should be in each group. In this case, 60% of people were in the most deprived areas. A little bit further on this, when we do it by population density, again, almost 60% of people in the most densely populated areas. And then finally, when we look at cause of death, we saw this pretty big shift towards external causes of death. So not death by natural causes, but death by other things. First of all, there was a pretty big increase in the number of suicides during this week. And that makes sense to me. If you're struggling anyhow, hot weather can really affect that. That's known from other literature. Also, accidental pharmaceutical poisonings and accidental poisonings from illicit substances. I'll talk about this a little bit, but I know that Michael's going to cover it in more detail. There are some pharmaceuticals and illicit drugs that change the way your body thermoregulates, and that's an important part of the consideration here. So anticholinergics, that's a hard word for me, that inhibit nerve impulses are actually used to treat quite a range of different illnesses, and they are one. They affect your ability to understand how hot you really are. Other anti-Parkinson's agents can have a similar effect. Diuretics, which may affect your ability to stay hydrated, antihistamines, the same thing, and then cocaine. So all of these drugs are associated with higher risk because they affect that thermal regulation. Since that last study, we've gone on to do some further work around the spatial indicators of extreme hot weather risk. And here we've looked at the greenness. So every day there are satellites that fly overhead. They measure how green an area is, and we can take composite index for the region. What you see here is the greenness in pretty much Vancouver alone. Those green areas are really green, whereas those light green areas have a lot more concrete and a lot fewer trees. What we found is that compared with people who lived in the highest greenness areas, even those who lived in the high to moderate greenness areas were at a 2 times higher risk of dying. And those who lived in the lowest greenness areas, 3.5, 3.6 times higher risk of mortality during this event. So that surrounding greenness really does help to protect the population. Again, Michael will talk more about this, but the concept here is quite simple. Staying cool means staying safe when it comes to hot weather. Air conditioning is the most effective intervention that we have. Obviously, not everybody has air conditioning, especially in this region where we've been so accustomed to a temperate climate for so long. Hydration is absolutely essential. It's hydration that allows your body to cool itself through evaporative processes. If you're not well hydrated enough, you can't sweat. Also, and I'm sure Michael will do a better job of this because he's a doctor, but the volume of your blood starts to shrink, and it makes it much harder for your heart to pump your blood around your body and puts a lot of strain on the heart. So that's kind of the mechanism by which people are really at risk. Wet skin can really help. So everybody always loves it because I say one of the best things you can do is just wet down your t-shirt, wring it out, and put it on. When it gets dry again, wet it down again, wring it out, and put it on, because that's going to help. Instead of you having to sweat, that water is going to do the cooling for you. And then, as we've already discussed, trees and water features can help to cool the surrounding areas and to make them a more pleasant place to be. I want to introduce you quickly to the BC Heat Impacts Prediction System, which the BC CDC launched earlier this year. And I cannot see him. Oh, I have to look up here, sorry. That should open this. There we go. So this is a web tool that is publicly available. It's not going to look very interesting today because it's pretty cool out there. I'm trying to make this larger, but it's not happening. Oh, nothing's working for me here. That's okay. I really just want you to know that this exists. There's some instructions here on the first page that I can't even scroll through. There we go. And when you read those instructions, they'll give you the necessary information. Wow, I cannot. Okay. This is not going to work for me, I don't think. Anyhow, the website is up there. It's also on this slide. What happens when you can accept all of the instructions is that you can then go down and click on any area in BC, and what's going to pop up is a map or a figure that looks just like this one. And over here, what you'll have is a forecast for the next few days about what the heat risk is. And that forecast is based on the temperatures that have been forecasted and in that region, the health effects that have been observed under those temperatures in historical times. So those health effects include both mortality and ambulance dispatches for types of illnesses that are associated with hot weather. And those orange and red bars will let you know whether there's moderate heat risk or high heat risk for those days. So just a tool that people can use to get a sense of what's going on over the coming days. Now I want to switch to talking about wildfire smoke. Obviously, we've had some very smoky summers over the last couple of years, even in the lower mainland where we've been quite distant from the fires. The PM 2.5 concentrations have been very high. That we were actually under advisory for 22 days last summer compared with 19 days in 2017. So I think everybody believed it couldn't get much worse than 2017, and then it did. When we look at PM 2.5 or fine particulate matter exposure on a population-weighted basis for the province, that means like this is the average exposure that every person in BC experienced. You can see 2016, not much going on. It was a very mild wildfire season, especially compared to the next two. And then 2017 and 2018, we see basically 6 to 8 weeks where PM 2.5 exposures are high province-wide. And we can see that the air quality impacts of 2018 were actually worse in terms of magnitude than the air quality impacts of 2017. I don't know what 2019 has in store for us, but I tell everybody we have to go into every wildfire season at this point expecting that it's the worst we will ever see. We can hope that it will be better than that, but trends over the past few years indicate that we need to expect the worst. So just a little bit about fine particulate matter. These are small particles, less than 2.5 microns or micrometers in diameter. You can see them here compared with a human hair, so they're a fraction of the size of a human hair. And these are troublesome because you can inhale them deep into your lungs. And when they get deep into your lungs, your body interprets them as a foreign invader, the same way it would a bacterium or a virus, and it mounts an immunological response against them. It tries to kill them. It can't kill them because they're particles. They're not alive the way viruses are, bacteria are. So this immunological response is sustained. And what happens under those conditions is that it throws your body into sort of a state of elevated inflammation. For healthy people, this inflammation is generally easy to tolerate, but for people with underlying conditions, that inflammation can be more dangerous. In addition, wildfire smoke is extremely irritating. So not only does it have these fine particles in it, it has volatile organics in it, and those volatile organics can really irritate the lungs. For anybody with asthma or chronic obstructive pulmonary disease, the combination of these particles and those other irritants make wildfire smoke particularly dangerous. Now, I don't want you to think that wildfire smoke is pretty pink balls floating around in the air. It's not. It's sooty, awful stuff. So if you look at the lower left-hand corner here, what you see is an agglomeration of very tiny soot particles. And then as the particles travel further from the fire, they agglomerate into larger particles and larger particles. So you get these strings of tiny soot particles, which is not, it's not just a circle floating around in the air. Not too long ago, a colleague asked, well, how many people are actually at risk due to air pollution events when they occur? And this is recently published in the Canadian Journal of Public Health. We went through the exercise of kind of calculating in the standard Canadian population how many people are at risk. So here I'm taking a population of 1 million average Canadians and adding this up for you. So susceptible due to age alone, anybody under 10 and anybody over 75. We put them in the bin right away. Susceptible due to asthma, that's going to be children, about 10 to 12% of children from 10 to 24 years old, and then we start adding some heart disease and some diabetes into those populations. And when we add everybody up, almost 1/3 of this standard population would be considered susceptible to the health effects of air pollution. So it's not a small portion of the population, it's actually a fairly large chunk of the population. And these are very narrow definitions of susceptibility. So if we increase those definitions to look at low income, nutritional status, we would go up to almost 2/3 of the population. Also, at the same time, about 16,000 women in this population are going to be pregnant. So the biggest effects of wildfire smoke, by far, are on breathing. No question, no hands down. And this is just a comparison of the number of Ventolin dispensations, so blue puffers that people with asthma are going to use, and the number of asthma-related physician visits in 2017 and 2018 combined, compared with that nice, easy summer of 2016. And what we see is almost a 40% increase in Ventolin dispensations over the 8-week wildfire period. It's about 43,000 extra puffers dispensed. So that's an indicator of how reactive our population with asthma and COPD is to this smoke. Again, almost 20% increase in the number of physician visits specifically for asthma, or 10,000 extra visits. That stuff's pretty easy to measure because the effects are huge and visible. There's things that are a little bit harder to measure. One of those is mortality. So we remember back to the hot weather event of 2009, we had this clear increase in mortality over those hot days. We don't see those kinds of increases during wildfire smoke. We can only see it statistically. So we know there's about 2 to 4 extra deaths on a really smoky day, but there's no way we can visibly detect that in the data because it's within the range of normal variability. What we do suspect, and what's becoming clearer as the evidence builds, is that those 2 to 4 deaths are mostly cardiovascular. So there's a big impact on respiratory health and respiratory morbidity, but not a big impact on respiratory mortality. Fortunately, those respiratory effects are not generally leading to excess deaths. But there are big impacts, especially on out-of-hospital cardiac arrest, which is a very severe health outcome. Your heart stops out in the community. Heart attacks and stroke. Those seem to be the things that are kind of adding up to be related to smoke mortality. And then I just want to talk about these pregnant women a little bit. That inflammation that occurs when you're breathing in smoke can also restrict the flow through the placenta of nutrition and affect the fetal growth of the baby. Not very much, but a little bit. So a big study in California found that there was about a 6-gram decrease in birth weight for women who were pregnant during a smoky period compared with those who were pregnant during non-smoky periods. That's not very much for any given baby, but what it can do is shift some babies into a low birth weight category. So if we multiply these California estimates out across our 16,000 pregnant moms, about 20 of those babies are going to be shifted to low birth weight, where they wouldn't have been in that category if not exposed to smoke. And being in a low birth weight category does have kind of lifelong health impacts. We've heard a little bit about indoor air filtration, and that is one of the primary protections against smoke. Most of us spend more than 90% of our time indoors. It's kind of sad, but it's true. This is just from a study we did in BC. This is during the 2003 wildfires. And on the left-hand side, you have indoor and outdoor PM 2.5 concentrations before the filter went on. The black line is the outdoor, the light gray line is the indoor, and you can see that they track pretty well. When it gets smokier outside, it gets smokier inside. That makes sense. That thick black line indicates where the filter got turned on, and on the right hand side we have those indoor and outdoor differences, and we can see that gray line stays low even when that black line continues to fluctuate. So indoor air filtration can be really effective for helping to protect people. This is just a little demonstration under not very realistic circumstances, but only to try to help you understand how less smoke inhaled also equals less risk. So when you're sitting around doing not very much, you're breathing about 7 liters of air per minute. Once you start to exert yourself, you start to breathe more deeply and more frequently. Even moderate exertion, going out for a jog, you're up to about 70 liters of air per minute. If you're going out for a run, you're up to about 110 liters of air per minute. So there's this huge change in how much air you breathe. So we've gone through this exercise of saying, okay, indoors it's 20 micrograms per meter cubed, outdoors it's 100 micrograms per meter cubed. Under these different scenarios, how much smoke do you breathe in, or what mass of particles do you inhale? The lowest possible exposure scenario is just chilling inside all day long. That sounds okay to me. I'm pretty lazy. The next is you chill inside and then you go for a walk, a 2-hour indoor walk on your treadmill. There's not much of a change there. And then you go for a 2-hour indoor jog, and then you go for a 2-hour indoor run on your treadmill, and then you start to go outside. And that top scenario is you're inside hanging out for 22 hours, and then you go for a 2-hour outdoor run. And you can see how much that changes your exposure compared with just chilling inside for 24 hours. So that's a really key message when it comes to wildfire smoke, is take it easy. And exercise is good for you. We don't want to discourage people from exercising. What we want to do is help them make good choices about where to exercise. And these are really good days to exercise indoors. My final slide is when smoke and heat meet. So unfortunately, wildfires do tend to happen when it's very hot outside, and we can get this piling up of the two exposures. Hot weather causes thermal stress. Smoke causes irritation and inflammation. They have different physiological effects on the body. These effects can definitely add up and put people under more stress, especially those people who are vulnerable to both sets of effects. So all of the folks with chronic underlying conditions, the elderly, pregnant women, infants, I would put people with low income status in that group as well. If you're vulnerable to both types of exposures, you're extra vulnerable when it is both hot and smoky. The key thing to remember here is that heat is the bigger health risk for most people. So cooling should be prioritized under hot, smoky conditions. If it's cool and smoky, that's better than smoke-free and hot. If you're going to have to pick cool. The perfect situation is cooler, cleaner indoor air, and I hope that's where we're all pushing to as we consider the changing climate that Tamsin's already introduced us to. So thank you very much, and I'm now handing it over to my BCCDC colleague, Michael Schwant.
Great. Thanks very much for the opportunity to speak with you about this important health topic today. I'll be going on to speak a little bit more about some of the direct effects on individuals, as well as some things that we can be doing as frontline providers to try to help people to avoid mortality and morbidity during that time. Now, first, I'd like to just play a quick video for you, and I hope that this works well.
Hot days and longer periods of heat than during the late 20th century, and it's going to get worse. Every year, about 120 people die from heat-related causes in Canada's big cities. In 2009, Vancouver saw a dramatic increase in the death rate during a week-long extreme heat event. Rather than simply extreme temperatures, it can be just the temperature change as well as a lack of adaptation that's threatening. Those living in BC's coastal and northern regions are the most susceptible to these changes. In those populations, seniors, people on certain medications, young children, low income, and socially isolated people are most at risk. Cities can make it worse. With the urban heat island effect, concrete and pavement absorb the sun's rays. Air pollution can produce and trap even more heat, worsening heat-related illness. So how do we protect people's health? Because the majority of BC municipalities don't have a plan to take care of their residents during an extreme heat event, the BC CDC has produced a preparedness guide. This includes locating community partners that can help, identifying municipal facilities that can be used as cooling shelters or water access points, and communicating what people need to know. In the long term, it's a municipality's physical and social structure that will protect people from extreme heat. Municipal incentive programs and building codes can result in better heat insulation through innovations such as green or heat-reflective roofs. Expanding and protecting tree canopies and providing public drinking fountains help too. Infrastructure is important, but so is social organization. People living in close communities do better in climate change-related events. In the 1995 Chicago heat wave, low-income African-American communities, where people didn't know their neighbors, saw increased death rates compared to equally impoverished Hispanic neighborhoods. The difference was the social inclusivity and openness in the Hispanic areas. We need to find innovative ways to bring neighbors together. We need to build cities where people can feel safe and get to know their neighbors in walkable neighborhoods that feature parks, community shade spots, and other communal spaces for all to enjoy. Heat health plans work. In Montreal, strategies such as water distribution, hot day visits to socially isolated people, moving care facility patients to air-conditioned rooms, and monitoring workers in warm environments have been effective in lowering the number of heat-related deaths on extremely hot days. Extreme heat in BC could be a killer, but working together can help. For more information about what cities and health professionals can do to combat extreme heat, visit us at the BC Centre for Disease Control or our partners at the National Collaborating Centre for Environmental Health.
So I think you'll find that a lot of what you've heard so far this morning resonated in that presentation. We'll be talking a little bit in more detail about some of the actions that health authorities, cities, and towns can take, as well as community-based organizations, who are an extremely important part of this response. Just as a quick word on what I'll be speaking about, I'll go a little bit more into the phenomenon of heat-related illness and specific vulnerabilities to that, as well as talking about planning for extreme heat and some resources that might be helpful in your work. So just putting this slide up here as a reminder, if it wasn't already clear from Dr. Henderson's slides, oftentimes people will talk about extreme heat events as an inconvenience or something that might be uncomfortable, but it's very important to keep in mind for our most vulnerable populations, this is absolutely a potentially deadly event, and we need to treat it with that gravity. There's a whole range of potential impacts with heat illness, all the way from heat rash or cramps that any of us might experience on a very hot day to actually experiencing exhaustion, and then moving into a set of symptoms that includes more neurological symptoms of confusion and lightheadedness when the brain doesn't receive adequate circulation. And when we start to see symptoms like an actual loss of consciousness, from brief fainting to a persistent loss of consciousness, we're really moving into what's described as heat stroke, which is really a medical emergency. So looking at this, and all of this will be available in the presentation online, but looking at the very top level there in this table, we see some of the symptoms of heat stroke that are including, as I mentioned, neurologic symptoms. So actually somebody being more confused than they might normally be, experiencing dizziness or a severe persistent headache. These are really symptoms that need to be taken quite seriously and respond with cooling that person down as quickly as possible, and ideally seeking medical support if those symptoms aren't quickly resolved. Heat exhaustion is this phenomenon where we're not quite into that level of severe neurological symptoms, but somebody might be experiencing extreme fatigue, they might be feeling lightheaded, still having heavy sweating, and again, really important if somebody's still engaged in physical activity or if there's any way to cool them off, to start to do that and monitor closely to ensure that they're actually responding and are able to cool down. And then earlier on still, we might have some of those more mild symptoms of heat illness that I described. So there's a few different factors affecting the burden of heat on a person. So we'll often talk about temperature, most specifically, for clear reasons. But as well as that, the humidity impacts the burden of heat in terms of our ability to cool through evaporation, ventilation, and I'll speak a little bit more about that, radiation, so being in direct sunlight, and finally just behavior, so what we're doing in terms of physical activity and clothing. All of these different things can impact heat on top of the actual temperature in degrees. A quick note on ventilation. People often ask about this. Is it better to turn on a fan even when it's really hot? And generally speaking, as a rule of thumb, if the temperature is a body temperature or below, definitely having any sort of wind, having ventilation is going to have a cooling effect. Will decrease the burden of heat on a person. So both an air conditioner that's actually lowering the temperature, or even just a fan that's moving air across a person, is going to help. At very high temperatures, once we move into the high 30s or even 40s, whether it's outdoors or indoors, having wind or ventilation actually creates a convection effect. And if you've ever experienced truly hot days in the wind, you'll know it doesn't cool you off. It actually increases the burden of heat. So that's something to keep in mind in terms of if you happen to be in a very hot space and you're looking after a client or a community, it's important to try to remediate that situation of those very high temperatures, and ventilation alone might not have the desired effects. Now, in terms of vulnerabilities, you've heard a little bit about this from Sarah so far, and there's a few different ways I'd like to describe this in terms of the actual physiological or biological vulnerabilities that we've heard a little bit about, as well as some of the social or environmental vulnerabilities that can increase risk. So first of all, as you've already heard, body temperature is normally maintained in quite a narrow range. Even on cold days or on hot days, our actual core temperature is usually within a very tight range. And this is necessary for all of the different biologic functions that support the function of our organs. As Sarah had mentioned earlier, when the temperature is disturbed beyond that point, or when we're dehydrated, it becomes very hard for our organs to carry out the normal necessary functions. So as you've gathered already, evaporation, i.e. sweating, is the main way that the body is able to cool off, as well as radiation of heat from flushed skin. And there's all of these main mechanisms can be affected by underlying health. So physical fitness, or on the other hand, obesity can affect that ability to cool off. A variety of pre-existing medical conditions, certainly including heart and lung disease, most particularly. Acute illness, certainly febrile illnesses that are causing a raised body temperature or taxing the body's systems already, and then how acclimated somebody is to heat. Definitely through the summer, a person, or even over the course of successive years, people can become more able to cool off through adaptation. Now, as you've heard earlier, and we'll get into this in a little bit more detail, specific medications and drugs can also make it more challenging for a body to cool off, and age has a big impact, at both extremes of age. So infants and very young children, both biologically, aren't as able to cool off as rapidly, and also behaviorally aren't able to identify to their caregivers as readily when they need to cool off, or when they might be experiencing symptoms that could be worrisome. And on the other hand, people in some older adults also are less able to readily cool off. So this is a long list. I won't read every single one of these out to you, but I think the key thing to keep in mind is it's a broad variety of different medications that can impact on ability to cool. And this is something that it's worthwhile for patients, especially with other vulnerabilities, to look at with their family physician going into hot weather seasons, even to look at with their pharmacist in those times. And look at, in some cases, there might be the option to even choose medications that account for someone's vulnerability to heat. And if you're looking at medications that are used on an as-needed basis, carrying in mind the balance of those medications' benefit, as well as the potential risks in times of extreme heat. It's something to be aware of in terms of our communities, as well as that other substance use. So alcohol and cocaine are examples that are provided here, can have detrimental effects in terms of the body's ability to cool itself off, and also can often be associated with a decreased ability to recognize early symptoms of heat illness and to seek help, or to get into cooler spaces. So people using substances can also be vulnerable to extreme heat illness. Now, in terms of social vulnerabilities, these are just a few, and in your work you'll probably be able to think of many others more specifically. Certainly most directly and clearly, access to cooling facilities, air conditioning to cool oneself in their own residence or in other spaces is a major issue. This is a great way to cool down, one of the central pieces of advice we give in public health, and also something that we know there's huge differences, disparities in terms of access to that kind of space. Isolation from health and social services, from community supports, is a very big issue in terms of heat vulnerability. And as well as that, there's many intersections at work here, and that those who are socially vulnerable oftentimes are also living in areas where they might be more environmentally vulnerable, and in some cases even have some of these physiologic vulnerabilities too. So oftentimes there can be many interacting risk factors. In terms of the environments themselves, and we saw some of this from the research from the 2009 extreme hot weather events, high population density, a lack of vegetation, lack of open spaces in the neighborhood can all cause increased risk of heat illness. And this is due to contributing to the heat load in communities. Dark-hued roofing, paving materials, pretty much anything that you see that could either reflect or absorb heat is going to have some factor in either keeping a community cooler or, on the other hand, allowing it to carry a greater heat load. And finally, we see things like vehicles or ventilation systems that can increase the heat in the space around them. This is just a quick diagram, and what you'll see here it's from Salt Lake City, Utah, several years ago, highlighting that in some areas, in the more, again, some of the areas with the more cooling environmental factors that I mentioned were still quite hot. They were 30 degrees in some of these areas, the blue. But meanwhile, some of these places that are colored red or white were as high as 60 or 70 degrees in terms of temperatures measured at the surface level. So you can see even within one small urban area, a huge variation. And that would be very true in a city with a variety of geographic and urban characteristics like Vancouver or some of the surrounding communities. This is just another diagram illustrating this urban heat island effect. You'll see in the orange graph there that the temperature throughout the day, the temperatures when measured, is warmest in the downtown areas and cooler in the surrounding areas. And this is even more pronounced at night, whereas the areas outside of the downtown are able to cool off. You'll see these persistent high temperatures overnight in downtowns, and really one of the major factors that makes extreme heat dangerous or even deadly for people is not just the peak, the high temperature in the afternoon, but the lack of a low temperature overnight. So the sustained high temperatures are really when we get into high risks. So our temperature warnings are based not just on the record highs that you'll read about, but on the lack of a cooling period. So when you see this overnight sustained temperatures that can be worse in urban areas, that's really a major piece of the risk. There is a lot that we can do. You've heard some of it already from Sarah, and you'll hear much more in the following sections of this presentation. Trees and vegetation, not surprisingly, can go a long way to helping to cool off of our communities. That can be in the context of green roofs and other interventions. Pavement surfaces, pretty much anything that's going to be out there and exposed to heat and to light is an opportunity for some sort of intervention at the community level. Now, of course, heat and air quality need to be considered together. We saw that last August in British Columbia with the intersection of extreme heat days as well as air quality events in August of last year. This was sustained actually for many days. And while we have the effects of extreme heat that I've already described, air contaminants can also exacerbate conditions of the lungs, airways, and heart, both directly in terms of some of the chemical pollutants and larger particulate matter in the air, in wildfire pollution, for example, but then also with those is a smaller particulate matter particles that, as Sarah described, can create an inflammatory effect that can, for example, increase risk for cardiovascular events. When you already have these vulnerabilities going on through the extreme heat, it can really be an additive or even multiplicative risk for people experiencing that. Certainly, these periods, as I mentioned, can overlap, and then many of the same populations are going to be vulnerable for that, whether you're looking at people of older age, people during pregnancy, young children, and some of the other risk groups that we've mentioned today. So in terms of planning, there's a few key things that I think that we can all be involved in, whether we're working at a health authority, a municipality, or a community-based organization. Having a plan ahead of time is really crucial. This is the right time to be attending an event like this or thinking ahead to what we're going to do and who's going to do it during these events. Because once these events come, it's an urgent or even emergent condition for those who are experiencing it. So already knowing what we're going to do in order to get into action is really important. So that includes identifying as much as possible susceptible individuals ahead of the actual hot weather events. And that could be where possible at an individual level in terms of individual clients. In some cases it might be at the level of a building or a given housing facility, or even different swaths of the community in terms of the risk factors we've been mentioning. But knowing who those people are, or at least what those communities are ahead of time, can really accelerate the response in the times of need. knowing where cooling facilities are and what are the strategies available ahead of time can be really beneficial. So what are the facilities in a given municipality? Could be community centers, libraries, similar facilities, whether they're willing to provide open doors access to all of the community during these times. It's important to know ahead of time. Trying to negotiate those sorts of things or determine that when you need to help somebody get to a cooler space immediately can be quite challenging. So as much preemptive work as we can do, the better. And all of these following points really go to that. Establishing links with the different partners that can support that work ahead of time, and sharing materials with both staff and with residents of supportive housing ahead of time, or social housing can go a long way. Some of the other points around monitoring surveillance might go more to larger agencies like the BC Centre for Disease Control or your regional health authorities, but even on a more micro level, having some sense for what are the numbers of people that are experiencing even mild heat illness and being able to be one step ahead is really important. So I think that these are all points that can be quite valid. And evaluating each year. How did the heat response go, and what can we do differently in subsequent years? This is a long list. I want to make sure that we leave time for the following speakers and for some questions as well. But I wanted to present this. This is from the U.S. Environmental Protection Agency. They've nicely arrayed a variety of advice, some of which you've already heard, in terms of advice for the public, for residents or clients, and then also for what have been called here public officials. And I would say that that's probably for everyone who's attending this, or many people who are attending this, those who would be involved in planning or communicating around the risk of heat. And this has, I think, just puts all of this in one slide that I thought might be helpful as a resource. Further to that, a couple of things I wanted to share. Health Canada has very recently developed some new communications on heat and health. This brings in some of the new evidence that you've been hearing from Dr. Henderson, looking at the specific vulnerabilities and just the magnitudes of risk that exist. I think that in some cases, as was mentioned, this can be actually underestimated or not fully recognized as a major risk. And some of these documents that you see here are, I think, quite useful in terms of public-facing or staff-facing documents that really get across both the risks and what we can do about it. And these websites will be linkable within the presentation to get these materials. Finally, as mentioned in the video at the beginning, the BC Centre for Disease Control has a lot of information available on both air quality and health, as well as heat and health. The document for municipalities planning a heat response, I think, can actually be quite helpful to non-governmental organizations as well. I've talked to many who have used this document in their planning, both municipal governments and community-based organizations. And as well as that, there's a number of fact sheets available on air quality and health, and that number is only going to grow in terms of some of the specific questions that we get from partners and from the public about methods to minimize the risk of health. Negative health outcomes during air quality events. So that's quite a great amount of resources online, and you'll learn more in the subsequent presentation about some resources available from other partners. So I'll thank you for your time and hand it over to the next speaker, Nancy.
Thank you, Michael, and Dr. Henderson. That was excellent. I'm going to follow this with a little bit about what we're doing at the City of Vancouver to prepare for extreme heat. So as Dr. Henderson mentioned, 2009 was quite a heat event in the City of Vancouver, and we did have a death, Curtis Brick, from exposure in Grandview Park in July of 2009. And that really triggered City Council to suggest that we come up with a better heat response. So our heat response is happening in two ways. Sort of our immediate emergent response is through emergency management and our extreme hot weather response plan. And then I'm responsible for the longer term planning through the climate change adaptation. So in terms of our immediate response, we have an initial response guideline, which has a bunch of tools within it. About response activities, notification templates, agendas, conference call agendas. And in April, we had our first meeting of this committee. So trying to get ready, asking what happened last year that didn't work so well and what could we do differently this year. Talking about response activities, so increased access to drinking water, providing shelter, monitoring outdoor spaces as well as indoor spaces, and getting better messaging and communication out. On the climate change adaptation front, we got our projections from the Pacific Climate Impacts Consortium, as I presented earlier, And then we've been working on some different actions. So this summer in 2019, we'll pilot some clean air shelters, which I'll speak about in the next slide. We've also been planting trees in tree deficit areas, so looking at some mapping, which I'll also show you, and targeting those areas for more tree planting. We add water fountains every year. We have temporary water fountains that go out as part of our extreme heat response, but we're also adding permanent water fountains every year and looking across staff and the community to find out where to put those. Temporary spray parks popped up last summer, as well as misting stations. So that idea of the evapotranspiration, getting your shirt wet. Our non-market housing has some temporary cooling measures in place, and now we're starting to look at how we can turn those into longer-term fixes to keep those spaces cooler. We're also working on a climate risk project with Evergreen, which I'll speak to more. What's not on here is that recently in our review of the Vancouver building bylaw, we did add projections to 2050. Right now, they're just a consideration, but working with BC Housing on their MBAR project, we hope to move towards new buildings and existing buildings having better cooling or better thermal comfort. So in terms of clean air shelters, this will be a pilot this summer. We haven't done this. Interestingly, we didn't find too many municipalities in BC that have done this. So we're going to combine them with the cooling centers. They will be rooms within these cooling centers that have portable HEPA filters, and we'll be assessing these. We'll also be looking at the ventilation in some of these cooling centers to see what we can do on a longer term basis to increase or improve the ventilation. The Climate Risk Project, we're working with Evergreen, which is a community organization. They've been doing interviews with social housing and community center staff to find out how things are going in the summer, how we could better support vulnerable populations during the heat events. And this summer, they have planned engagement activities with seniors and residents to understand how the city can better support people during both air quality events and heat events. Here's some mapping we did with SFU and Health Canada. So this is surface temperature mapping, canopy cover overlaid. And we also overlaid this with mapping of vulnerable population indicators to target where we should increase tree planting. So there's 3 neighborhoods identified, and in the Urban Forest Action Plan, they're targeted for much more tree cover. We've seen a few maps like this morning. This is imperviousness in Vancouver. So of course, those areas that are darker have more asphalt, less tree cover, and also tend to be the hottest areas in the city. We publish all this information on where the water fountains are, both temporary and permanent, and look to fill the gaps where we could add more access to water. We've got our cooling centers. There's 9 cooling centers, generally community centers and other public spaces that provide air conditioning in lobbies, and we'll be targeting these for the clean air shelter pilots as well. We've looked at passive cooling measures for buildings, and now we're looking more into how we could introduce active cooling and passive cooling with the Passive House. Trying to update our communication tools. So we've got our Keep Cool campaign online. We've also got brochures that fold up like fans and have maps of the cooling centers, etc. Other tools, we have a bunch of templates to help us during those target emergency events. So when those events happen, we know who's doing what. So you've got the function, the activity, whether we're doing it during a weather statement and a heat warning or just during one, and who's responsible. So it's all laid out, and then we do a post-evaluation at the end of the summer. So this is just another example. This is the conference call agenda that's set ahead of time for one of those weather triggers. So that's what we're doing at the City of Vancouver. We welcome feedback to improve our heat response and our long-term planning for heat. So thank you, and I'll pass it to Magda from BC Housing.
Thank you. So I will focus on kind of tools and resources that we've developed. As you know, at BC Housing, we not only work with nonprofit housing providers, but we also have our own stock. So basically, we're trying to share what we've done, and it's definitely work in progress. So I'll talk a little bit about what we do in terms of preparation and planning. A few words on checking on tenants specifically, because that's something that's requiring more resources. And what else we're doing in terms of increasing social connections. We've heard from, I think, all of the speakers that one of the, apart from infrastructure and what we're doing, one of the key resiliency indicators is social support network. And so that's one of the areas where we're looking at increasing with our tenant population. And then some of the tools and resources that we are using, some that we've developed and some that are already existing. So our plan has sort of 3 phases. What we do before the summer, so preparation, what happens during regular summer days, and then what happens when there's actually extreme heat or poor air quality warning issued. So part of the before the summer, so that's activities, those are activities that are happening around now, sort of April, May. There was actually discussion about, when we need to start preparing, and it seems that we need to start preparing earlier and earlier. So we have people who are working with our tenants on daily basis. So that means building managers, housing and health support services, tenant support workers, people who know our tenants get together. And first of all, we're trying to focus on providing training education for that group so that they know some of the things that, again, we covered were covered by previous speakers in terms of knowing how to recognize heat-related illness and what to do. So just kind of educating ourselves. And then the next step is identifying who within the given building might be most at risk. So we do know that pretty much everyone is at risk. All of our tenants are, fall into the category, and all of us, in the room are sort of at risk of extreme heat-related illnesses. But we also know that we have limited resources, and so being a bit more aware of who we need to be most concerned just helps in terms of planning and distribution of resources. Preparing all the buildings, so our building managers go out and look at what might be some opportunities for, what is the risk of overheating particular parts of the buildings, and where can we maybe provide some of the cooling. So all of our sites right now in the Lower Mainland, none of them have central air conditioning. None of the housing units have air conditioning, but we've installed portable air conditioning units in common areas. So at least within a given building, there's a space where the tenants can go and cool off. So that's one of the examples of what a building manager may do in preparation for the summer. And then looking at what equipment they may need. So if they want to create a cooling space, are we looking at buying portable AC? This, based on our last summer's experience, we also purchased air purifiers with HEPA filters, and some of the spaces don't, they may not be as at risk. So for them, we went out and bought fans. And then looking at some of the communication tools for the tenants, so that when the hot weather hits, we are prepared and we know we have resources to communicate. So none of it is super complicated, but it's easy overlooked. All of our staff are very busy with dealing with a lot of different issues, so we try to make it as simple and as consistent as possible. And one of the tools for that is creating a bit of a checklist that includes all those different things that I mentioned. So, the teams for each given building get together, and then they kind of go through the list and make sure that they cover all the points. I'm not going to go through them, but basically cover everything that I've already mentioned. Similarly for when the summer starts, just making sure that everything is activated, that we have the communication tools out, that the cooling space is open and available for the tenants, and also there's information that that's the case, because we may have a room and there might be tenants who may not be aware that they actually have a space within the building where they can cool off. And then we have times where there will be extreme heat. And so part of our own training is being aware of when the warnings are issued by the Environment and Climate Change Canada, as well as the local health authorities. And that's when we this sort of higher risk mode kicks in. So we have a separate checklist for what we do when that hot weather alert is issued. And it's really just about activating everything that we've prepared for. And then when it's really hot, there is a decision point that's made by our director, who's responsible for the whole portfolio, whether we should activate resources to do direct checks on the tenants. So those tenants that we pre-identified before the summer who are most at risk, we actually do the door-to-door knocking and checking on our tenants. It's not sufficient to just knock on the door and say, are you okay? Yes, I am. We're actually trying to encourage the staff to do a bit of an assessment of the environment of the unit that the tenant is, looking whether there's opportunities to cool the unit, whether they have the blinds down, if it's hot outside when it's inside, whether they have some sort of fan, and also doing an assessment of the tenant. And overall, our tenants have a lot of different barriers and are vulnerable, and they may also display those behavioral risks that Michael sort of mentioned in terms of, are they wearing heavy clothing? Are they drinking and so on? So doing a bit of an assessment of can we support the tenant as an individual. And not only we do those checks, but also something that's only been implemented the last couple of years is we actually keeping track of who we visited, what was the outcome of the visit. So this is just an example of a template. This is kind of what it morphed on the ground, where we keep track of who's been visited and what was the outcome. And again, trying to make it as simple and as efficient for our staff because everyone is busy. So rather than sort of writing individual response, we have a menu of A, B, C, D. So then it's easy to just click, check on what the scenario was. Social connections. We are lucky at BC Housing, we have resources that we have community developers working with different partners trying to encourage and build community. But the last couple of years, we actually specifically focus on can we encourage the social connections for response when there is some sort of crisis. An extreme heat event is sort of one example. So we've done a pilot with Shift Collaborative on how to increase social connections and included those 3 components in terms of encouraging neighbors to get to know each other and to take care of each other in times of some sort of crisis, as well as emergency preparedness. And all those things kind of come together. So it's not just enough to create a cooling space, but if it's a space that's not exciting, it's not nice to be in, tenants will not go there. So we try to combine our community development programs with the cooling spaces program. So there's an example of one of our sites where we have a community event, and there's fans, and you can see on the side that there's a poster on tips how to beat the heat. Here's another version of that poster. So trying to sort of convey to the tenants some of the behavioral things that they can do and communicate not just through language but through images. We've created a separate page on BC Housing website when we post all those resources. So if anyone would like a copy of that poster, it's available for download, as well as some other resources, including the video that Michael showed earlier, because it's a great educational tool, that video. And then we use the existing resources. So the Center for Disease Control has a whole bunch of different resources, and from posters and infographics to Twitter messages. So we have been tapping into those. Environment Canada produced a guide how to communicate health risks. So we just pulled out the practical information that we can use in terms of sound bites on how to communicate. And then just being aware, so using the advisory websites where, BC government produces a Smoky site where you can, Smoky Skies information bulletin where you can get informed in terms of what the air quality is. And then there is the Air Quality Health Index that lists all of the communities across BC, so you can see how much are you at risk. And that's it for me. Thank you very much.
Thank you so much to our speakers for sharing all that information, incredibly practical information. We will now be taking questions. We'll take questions first from the audience. We do have a microphone, so please, if you have a question, just raise your hand and we'll bring the microphone to you. Just make sure you hold it nice and close to your face so we can hear, as well as those folks on the webinar can hear. Any questions, or if anyone wants to share some of their challenges in their own buildings? Yes.
Hi, first of all, I work for BC Housing, and I wanted to ask Tamsin, could you explain a little bit more about the cooling degree days? I didn't quite understand that.
Sure, thanks. That's a good question. So cooling degree days is just, it adds up the degrees over 18 degrees throughout the year. So it's a measure of how much cooling we may need inside our buildings. So with the climate change projections, we're looking at a 3 to 5-fold increase in our cooling degree days. So just giving us that expectation that we're really going to have to start cooling our buildings either passively or actively. So at the city, we're promoting heat pumps as a way to do that, to also, of course, keep our energy efficiency up.
I have a question for Sarah. I'm just wondering, you talked about the particulate matter generated by smoke. How effective is vegetation at removing that particulate matter, particularly from smoke?
Not very. So particles of that size do stay aloft in the air for a long time. They may have some local settling on surfaces, but I would not trust those surfaces to draw the particles in. That's not how things work. Really, the only thing that's going to reduce smoke particles in the air is a good rainfall, because that will wash them out. So there may be some very minor benefit of having vegetation in a room, but the comparison with actual active filtration would be negligible.
I have a question.
Is it a question for me?
Yes, it's a question for you, and perhaps for Michael. So my question is, well, Michael, you mentioned acclimatization is one of the reasons that people can have trouble with heat if you're not acclimatized. So with climate change, if we're looking to 2050, so another 30 years of it being that much hotter with 37 degrees, are we going to be acclimatized by then and thus see less heat stress, or is it just going to happen too quickly?
Michael may want to add to this, but I'll start. Yes, so the population behavior is a really important part of this, and again, we've lived in a temperate climate in this region for a long time, so people don't necessarily know how to behave in the heat. As heat-related behavior improves, I would expect to see some reduction in risk, but that it won't negate the risk entirely.
Yeah, it's a great question. And we know that when we look at the data on the impacts of a warm day, so for example, 28 or 30 degrees in June is likely to have more of an effect on morbidity and mortality than the same heat in August, when people have become used to it, both physiologically in terms of ability to cool off, and probably more importantly behaviorally in terms of cooling the spaces they're spending time in, changing their activities, clothing, etc. So we do see those changes even within a given summer. And the question of whether or not we'll have that adaptation in terms of practices and so forth to be able to manage that over time is something that's a topic of ongoing research, and there has been some effort to look at that, and it's something we'll need to follow as we experience more and more of these warmer days.
Hi, my name's Maya. I work with Magda. She's my boss. My question is about, and it's for either of the doctors, about wearing masks during poor air quality days, because I've heard that there's a little bit of new information that people don't know. That would be good to share.
Yeah, I'll hand it over to Sarah. She's in fact a leading expert in exactly this topic.
I wouldn't call myself a leading expert, but I did lead the BC CDC evidence review on this topic, so I'm fairly familiar with the most current literature. Here's the lowdown. N95 respirators are the most effective type of respiratory protection. The biggest variable is how well fitted they are to your face. So if the seal is good, an N95 respirator can provide effective protection from wildfire smoke and other types of fine particulate matter. They cannot provide effective protection from the gases in wildfire smoke, such as those volatile organics. So if you have asthma and you're particularly sensitive to the volatile organics, the N95 respirator is not going to help you. There are several caveats to recommending the use of N95 respirators. First of all, they make it more difficult to breathe. This is particularly true for older people whose lung volume decreases as they get older. So that restriction on breathing is probably a bigger detriment than any protection the mask can offer. Second of all, they only remain effective when they are dry and used properly. So if you start sweating into your N95 respirator and it gets saturated, its effectiveness is drastically reduced. They're really uncomfortable to wear, so people take them off. It's not fun to wear an N95 for 8 hours. I don't know if you've ever tried it. They're not a pleasure to have on your face. Third, people may feel that they are protected by wearing an N95 and then go on to do things they wouldn't do if they didn't have the N95 on. So this kind of false sense of security, maybe somebody goes out for a jog with an N95 where really it would have been better for them to stay inside and jog on a treadmill on that particular day. So that false sense of security is something to be very aware of. That's kind of the clearest messaging that I can give you. In general, we do not recommend them as a first line of defense for the population. Cleaner indoor air is the best way to protect people. Again, we're inside 90% of the time, most of us, and outside 10% of the time. If we're protected that 90% of the time indoors, the outdoor exposure, especially if we're taking it easy, is marginal compared with the exposure we've been protected against indoors. Where we really do recommend respiratory protection is for people who have outdoor occupations and who have the support of their occupational health and safety professionals to ensure that they have the adequate type of respiratory protection for the work that they are doing. Anything further?
Yeah, so one thing that I would add just on that note, so I think that Sarah's really nicely laid out this balance between respiratory protection and these potential detriments. And this is all for a properly fitted N95 respirator. When we're talking about any mask other than that, if we're talking about just a plain surgical mask, a bandana, or anything like that one might use, then all of those negatives are still there, the increased work of breathing, etc., with none of the positive, very little of the positive from those. So when we're talking about that balance, that's really for the top of the line, and for these, most of what someone might get off of the shelf is going to be not even in our recommendation toolkit at all.
Question from our online audience. It's a question for Magda, and they're wondering the templates that you shared related to checking on tenants, and those templates, are they going to be available in Excel or just on the slides?
We can make them available in whatever form is useful. I don't think they are right now posted on that site. So if you go BC Housing and Extreme Heat, under partner resources, there's all those other resources, but we will post those templates, and you can also contact me directly. I'll be happy to share them directly as well.
We have another question there, great.
I'm not sure who to direct this to, but my question is regarding forest practices, and how much does our forest practices contribute to the actual wildfires in a given season? Does anybody know any information on that?
I know a little, as I was just at a Land Summit presentation by Laurie Daniels, the forest management fire guru. So our wildfire behavior today is directly related to our management for the last century. So really, in the rainforest area of BC, where we haven't seen fire in the past, our forest management is directly contributing to wildfires. So our slash piles, our forest management in the interior as well, where there used to be lots of patch fires. The mountain pine beetles created a lot of fuel supply. So certainly our forest management practices are directly impacting that. Did you have something to add, sir?
I want to add to this. Yes, forest management practices over the past decades have certainly affected current wildfire risk. Climate change is affecting current wildfire risk. These two things are stacking up on top of each other. The mountain pine beetle damage is affecting wildfire risk. In all of that, I just want to make clear there's no quick fix in terms of forest practices. It's not like we can change the way we do something and next year the wildfire season will be better. If we can improve forest practice in terms of wildfire risk, those are changes that are going to play out over decades, the same way that decades of practice have put us in this situation now.
I'm wondering if anyone in the audience who works in community housing has any stories that they want to share or any challenges that they're going through, or perhaps what you'll be planning or any goals for the extreme heat. Have you noticed a change in the tenants you work with? If anyone would like to share, just raise your hand. No? Okay. All right. If there are no more questions online in the audience, okay, then I would like to thank our speakers today. Tamsin Mills from the City of Vancouver, Magda Sapala from BC Housing, Dr. Michael Schwant from BC Centre for Disease Control, and Dr. Sarah Henderson from BC Centre for Disease Control. Thank you. As I mentioned, we will have all materials available. If you signed up with your email address, we'll be sending that as a communication. If there are any more questions that aren't online right now, you want to send them to us, we can also answer those as well. Thank you so much for attending here in person and for those of you online in the webinar, and have a great rest of your day. Thank you.